of a glossary and introduction. We know that vector-borne infections are transmitted by arthropods, either to humans and to wild and domestic animals. As you can see here, there is an anthropogenic cycle of infections involving only humans, and a zoonotic kind of cycle involving both animals and humans. Among the first group of diseases, there are malaria, at least most of malaria cases, apart from malaria due to Plasmodium knowlesi, dengue, and yellow fever. Among the second group of infections, as you can see, there are Lyme disease, antiviral diseases, and most arboviral diseases. A clear demonstration of the relevance of vectors is the fact that mosquitoes are the world's deadliest animal, causing more than 700,000 deaths each year, far more than other animals, including human beings. Looking at a question, what factors are important for transmission of infections through mosquitoes? We have to consider this formula, which was elaborated by Brady and collaborators in 2016, which provides a possible answer. As you can see, the vectorial capacity, which is V, equals to a product of many factors, including mosquito to human ratio, the human biting rate, the daily mosquito survival, and the parasite extrinsic incubation period in days, which is the time spent by the pathogen into the vector before giving an infection to the human beings or animal hosts. There are two important vectors, mosquitoes and ticks. The main differences between mosquitoes and ticks are shown in this slide. As you can see, part of the mosquito's life is terrestrial and part is aquatic. By contrast, ticks, which live longer than mosquitoes, stay only in a terrestrial environment. What is very important to understand is that even though the life of mosquitoes in general is shorter than the life of ticks, the eggs of some mosquitoes, in particular Aedes albopictus, are able to stay in the environment for a long time, which makes both mosquitoes and ticks very resilient organisms in the environment. Just a few percentages. 60% of all diseases affecting mankind are due to zoonotic agents, which are often vector-borne, and 65% of all emerging or re-emerging diseases are due to zoonotic or vector-borne agents. This gives you a measure of the relevance of these infections, and also historically, as you can see in this slide, many newly emerging or re-emerging or resurging infectious diseases were vector-borne. These are those framed in the slide, such as West Nile, Lyme, chikungunya, antivirus pulmonary syndrome, dengue, yellow fever, and so on. Unfortunately, most of these diseases are neglected, which means that organizations, political, social, and medical worlds do not give enough attention or care to these diseases. As you can see, leishmaniasis, trypanosomiasis, Chagas disease, dengue, lymphatic filariasis, onchocercosis are all neglected diseases according to the WHO. Despite this, as you can see in these slides, despite the fact that several vector-borne infections are neglected, these infections exert a significant impact on human health in terms of disability-adjusted life years. Dengue is missing in this list because we don't have enough data to measure the dailies, but for African trypanosomiasis, yellow fever, leishmaniosis, Rift Valley fever, and Japanese encephalitis, the dailies are very substantial, as you can see in this slide. The second point on the agenda is the impact of climate change on disease vectors. Climate change is defined as a long-term change in the average weather patterns. It is a very complex phenomenon, and human activities are mostly responsible. The burning of coal, oil, natural gas, clearing the land by cutting down forests, intense agriculture increase, the release and reduced capacity for absorption of gases, all these lead to progressive increase in the mean global temperatures, but also rising sea level, changes in rainfall and in the frequency and intensity of extreme weather events. It is believed that over half of known human diseases are aggravated or precipitated by climate change, and in particular, more than 50% of infectious diseases have been at some point aggravated by climatic hazards. This slide is very nice. This graph shows you the impact that climate change has on different types of infectious diseases and highlights that vector-borne diseases are indeed the most affected. Out of 360 diseases, 103, which is 29%, are actually vector-borne. Many studies suggest that climate change will promote a redistribution of vectors and vector-borne diseases. The altitudinal gradient vector-borne pathogen range, for example, for malaria and Lyme disease, may extend to higher altitudes the presence of vectors and the relative diseases. But also, as you can see in the second figure on the right of the slide, there is also an expansion of vectors towards the poles of the world, which means that vectors are expanding all over the world. This slide shows the thermal response of mosquitoes and tick vectors to key biological traits. As you can see, there is a very wide range of temperature at which these insects can live, bite, and reproduce. And this clearly demonstrates the great adaptability and evolutionary advantage of these insects in the era of climate change and global warming. I think that the winner is the mosquito of the genus Aedes, particularly Aedes aegypti, but also Aedes albopictus. In fact, Aedes aegypti, for instance, is a very aggressive mosquito. It bites during the day. It prefers human blood meals. It has a domestic lifestyle because it enters homes to feed, And it's able to survive even in very small quantities of water. Which means that this mosquito is able to survive and live and reproduce very close to where human beings live. And this is, of course, very dangerous for us. As you can see here, Aedes aegypti, which originated from Africa and which is, as you all know, the vector not only for yellow fever, but also for chikungunya, dengue, Zika, and the West Nile virus. It already entered Europe because for the first time in 2022, it has been reported in Cyprus, which could act as a port of entry into Europe. So we have to monitor very carefully whether or not this mosquito will spread beyond Cyprus to invade the European continent, which has already been done for Aedes albopictus, which is the Asian tiger mosquito. As you can see here, the distribution of Aedes albopictus in Europe in 2013, expanded in 2019, and even more in 2023, clearly indicated the great potential of this mosquito to cause diseases in several parts of the world. For Culex pipiens, which is the most common and abundant mosquito, especially in northwestern Europe, this is the distribution, as you can see, very wide across the European continent. As you all know, Culex pipiens is the primary vector for transmission of both Usutu virus and West Nile virus, which are diseases transmitted from the mosquito, both to human beings and to animals, such as horses and birds. One very interesting experiment, let's say, was done in Austria in 2008, 2009, when the investigators were able to find West Nile positive birds in several parts of the nation. And further investigations showed that there was a very dense network of infected animals, both horses and other animals and birds, and of course the vector in the region, as you can see here. So these aspects are very important because they indicate the importance of making and continuing monitoring the presence of these infectious agents in vectors, in animals, and in human beings according to a One Health approach. We cannot, of course, forget malaria, which is, according to some opinions, being substituted by other diseases. But nevertheless, malaria is a big killer. As you can see here, 249 million malaria cases and many deaths, especially among children below the age of 5 in the world. What is important to recognize is that the vectors which are potentially able to transmit malaria are present in Europe as well, and in Italy, as you can see here, Anopheles labranche, Anopheles superpictus, and recently I think 2-3 weeks ago, Anopheles sakharovi was found in Puglia region. Luckily enough, these mosquitoes are not very efficient in transmitting Plasmodium, apart from Plasmodium vivax, which is more easily transmitted to human beings by Anopheles labranche. But in general, the efficiency of this vector to transmit malaria parasites are not very important. Anyway, it is important to monitor this phenomenon, to monitor the possible presence of Plasmodium parasites in the vectors and possible cases of autochthonous malaria, which is a reality. In fact, 13 confirmed cases were reported as acquired in the European Union, as you can see in these very last reports by the ECDC. Looking more in depth to these cases, many of these were cases associated with airports, but 3 cases were categorized as cryptic, which means that epidemiologic investigations failed to identify an apparent mode of acquisition in France. What are the emerging trends in vector-borne diseases in Europe? I want to say first that it is very important to make a syndromic surveillance. So it's very important that the clinicians are able to recognize as soon as possible these diseases in order to react appropriately by treating the patient and preventing transmission of this infection to other people. Since we see only what we know, it is very important to teach how these diseases present. In fact, in this part of the talk, I'd like to introduce some infectious diseases of interest in this respect. The thesis is that syndromic surveillance is crucial, but to detect these diseases promptly and efficiently, we need to know them. Part of these diseases are autochthonous, but part are imported and therefore are relatively new for us as doctors living in industrialized countries. This is a list of the diseases of interest: West Nile, Usutu virus, Toscana virus, sandy fever Sicilian virus, sandy fever Naples virus, tick-borne encephalitis, chikungunya, dengue, and Zika. Apart from poor knowledge, it is important to recognize that many vector-borne diseases are asymptomatic. And therefore, syndromic surveillance can be inefficient. West Nile disease is asymptomatic in about 80% of patients, Zika in 80% of patients, dengue in 59% of patients, increasing to 66% during outbreaks. Tick-borne encephalitis is asymptomatic in the 35% of patients, chikungunya up to 28% of patients. Starting from chikungunya in Italy, we had several outbreaks over calendar years. We had one in 2007, one in 2010, 2014, 2017. I was working in Calabria region. We had an outbreak in Guardavalle Marina in 2017. Luckily, during the last month in Europe, No cases were recorded, but we had in the world several nations with a lot of cases. For instance, in Brazil, in Paraguay, in Argentina, and in Bolivia. The problem with chikungunya is that this is a disease of returned travelers. These are very important data from the GeoSentinel group, which recorded the imported cases from 2005, 2020, a total number of more than 1,000 cases. As you can see, the distribution reflects the countries visited by patients and the epidemiology of the disease in these countries. But what is important to recognize is that only 32% of patients who got the disease received appropriate pre-travel consultation, which means that this is a neglected disease. It is important to implement the activity of the travel clinic and provide travelers with appropriate information to prevent the disease or to recognize the disease as soon as possible when symptoms arise. Regarding dengue, the profile, the epidemiological profile of the disease is very different. We know that the incidence of dengue increased by 30-fold because of global warming. We know that the clinical syndrome ranges from a symptomatic disease to a simple dengue fever to severe hemorrhagic complications. And the result of the increase of 30-fold in the incidence of the disease is well illustrated in this slide. As you can see, many regions of the world are severely affected. As you can see, there is an emergency ongoing in Brazil, in South America and in other countries, but also in Europe, locally acquired cases were detected in Italy, France, and Spain. In Rome, we had a very recent outbreak. These are the first cases detected during this outbreak, but what I want to emphasize through data we have collected in an opportunistic study performed in patients living with HIV and followed in my center is that several patients tested positive for IgG anti-dengue virus, even though they were not reporting any symptoms, and this positivity was not correlated, was unrelated to the recent outbreak, which means that the virus probably was circulating well before the recognized outbreak, which happened during the last month of the last year. And what about the future? The future is like this. It will depend on the climate change, but the worst case scenario is illustrated in the picture on the upper right corner of the slide. As you can see, Europe will become red if the climate changes will be worst in this projection. Zika has already entered Europe. This is a report of 2019 published in Lancet, I think. Yes, in Lancet. As you can see, a case was reported. The first local case of Zika virus was reported close to Marseille in France. We know that the virus was first documented in monkeys in Uganda. Then there was a spillover to human beings, and then the spreading of the virus all over the world. In Italy, we had few cases, all important, but imported, but all important because we know that Zika virus has important implications for the health of the newborns. We also have novel phenotypes of the disease, including the Guillain-Barré syndrome in adults. And the problem with Zika is that secondary cases can also happen because of vertical transmission and sexual transmission. So in this case, vector-borne transmission is kind of a bridge towards a potential further spreading of the infection through different routes. Regarding West Nile, this is the first outbreak, which was very well studied in 2018. But West Nile virus was present well before 2018, about 10 years before. And this is the actual situation during the season 2023, 2024, up to January. You can see here many cases in Spain, in France, in Italy, and in other countries of Europe. This is the situation in Italy. You can see here how it's important to monitor the presence of the virus in the vectors, in the animals, and in the human beings to give a more comprehensive picture of the circulation of the virus in the country. I want to remind you that West Nile virus presents with several clinical syndromes. There is the tip of the iceberg, around 1% of cases, which are neuroinvasive, with meningitis, encephalitis, and acute flaccid paralysis. But about 80% of cases are asymptomatic or pouchy symptomatic. Let's go to ticks. The tick-borne infections are many. They are due either to bacteria or viruses or protozoa. We also have many ticks. This is the phylogenetic tree of the ticks, but two ticks are most important. The Ixodes tick, which is the hard tick, and the Rhipicephalus, which is the soft tick. Anyway, apart from this distinction, it is important to say, as illustrated by the figure, that the biological cycle, for instance, of Ixodes ricinus changes in relation to the effect of climate change. In other terms, an earlier spring favors earlier egg laying of the tick, and concomitantly, a longer summer causes humans to be exposed to ticks for a longer period of time. And both these factors aggravate the risk of infection and spreading of the diseases. Another important factor is the bird migration related to climate change. And we know that birds can carry ticks, as you can see here in this very nice article. Close to the eye of the bird, you can see the tick. And it's very difficult for the bird to eliminate the tick when the tick is in such, a position on the body of the bird. And you can see here multiple engorged ticks removed from a single bird. Tick-borne encephalitis. It is transmitted by ticks. You can see here the distribution and the incidence of these diseases around Europe. The incidence is expressed as cases per 100,000 population in each country. As you can see in the Northern Europe, the incidence is much higher than in other parts of Europe. There is a correlation with season. In fact, the cases are more frequent during the summer. But I want to drive your attention to a very important study, which was made in Sweden. As you can see here, these authors investigated the presence of antibodies against the tick-borne encephalitis virus. They were also able to distinguish the antibodies against the virus and the antibodies against the vaccine, because as you know, there is a vaccine for TB. And as you can see here, the number of cases which were notified is 2,627. But looking at the antibodies, it appeared that more than 100,000 people got the infection, which means that the infection was mostly overlooked. So this is important to understand that in order to get a real picture of the circulation of these agents in a population, we need to conduct sero-epidemiological studies because syndromic surveillance can be insufficient. Regarding the Lyme disease overall, on average, 128,000 cases are reported annually. Unfortunately, only 48% of countries around Europe were able to provide public available data from surveillance program, as you can see here. So there is a need to extend national level surveillance around Europe. In several countries, the incidence was pretty high, especially in Slovenia, Northern Europe. But as you can see here, in most cases, the curve is, let's say, fragmented because we need more data in several periods. Another problem is that there are several definitions of Lyme disease, and probably we need to harmonize them. The disease, as you can see, passes through several clinical syndromes. There is an early localized disease, an early disseminated disease, a late disseminated disease, and also there is chronic Lyme disease consisting of late disseminated Lyme borreliosis, Lyme disease with post-infectious sequelae, and post-Lyme disease syndrome. For the first time in 2018, the European Union introduced a wide surveillance program for Lyme noroborreliosis, and we will look at the results of this surveillance, which at my knowledge are not currently available. Rickettsiosis are a group of diseases generally caused by Rickettsia, which is a genus of obligate intracellular bacteria. You can see the distribution of the different species, and you can see here the soft tick, which is the vector of the disease. You can see here that dogs and rodents are involved in the cycle of this infection, ending up with infecting human beings. This is the several species, the several diseases. Some diseases are pretty new, such as Ebola, and merits more studies. And also epidemiology is not very updated. There are data for the period 2001, 2009, and as you can see in Italy, for instance, there were far more than 4,000 cases, especially in the south of Italy. And what is interesting to know is that according to a very nice review paper, we also have co-infections between different Rickettsia species. As you can see here, Rickettsia plus Ehrlichia, Rickettsia plus Anaplasma. Unfortunately, our preparation to diagnose these infections in Europe is very poor compared to the United States, which means that we have to work more on diagnostics for this kind of the diseases. Another problem is African rickettsiosis, which are not present in Europe. They are present mostly in Africa, and especially in the South Africa. But still, it is important to know that they exist as far as several cases were reported in tourists returning from South Africa, especially from the Kruger Park, which is an area where there is a density of infected vectors, which is, let's say, alarming. So if a patient, if a person is going to the Kruger, please inform her or him how to prevent the infection. And last but not least, it is important to make an accurate surveillance on low-borne diseases. For instance, you can see here that several reports are emerging of low-borne relapsing fever in refugee, for instance, in this case from Mali, which was likely acquired in Libya and probably due to overcrowding and poor hygiene conditions of migrants passing from these countries during their journey. Leishmaniasis is also a very important disease. The vector is not a mosquito, it's a phlebotomus. Leishmania infantum is the only autochthonous Leishmania species in Europe, according to the CDC technical reports. As you can see here, the distribution of Leishmaniasis due to Leishmania infantum. But don't forget that in Greece and in the Mediterranean basin countries in Europe, other species of Leishmania were found, which means that we have to maintain and reinforce surveillance because, you can see here, the title is very nice, Knock, Knock, Knocking on Europe's Door, Treat of Leishmaniasis in Europe with a focus on Turkey. So several countries can act as a port of entry of the disease into Europe. Italy is involved, as you can see here, the distribution of the disease in 1983, 2010, 2020, it was increasing. It is related to dogs, but also to dry, let's say, for instance, this kind of wall, because the insect loves to put her eggs in dry, for instance, walls like these. So water is not a problem for this disease, but for instance, walls like these depicted in the slide can be dangerous. Adaptive strategies for public health. As I have underlined several times during my presentation, it is important to implement a One Health approach. It is important to recognize the hazards, the exposure, the vulnerability, and the impact that vector-borne diseases can have on health of animals and human beings. It is important to act on hazard, exposure, and vulnerability through mitigation and adaptation strategies. As you can see here, adaptation options such as universal access to care and disease management, improved disease surveillance for vector-borne diseases, integration of surveillance of vectors and human health, and so on, then these actions, these options can decrease the number of cases, which means that with these options, we can get adapted to the consequences of climate change on the spreading of these important diseases. There are 5 sequential steps comprised in the BRACE framework: forecasting climate impacts and assessing vulnerabilities is the first step. Projecting the disease burden, the second step. Assessing public health intervention, the third step. Developing and implementing a climate and health adaptation plan. And lastly, evaluating the impact and improving quality of activity. This is a cycle that should never stop in order to adapt and control this problem. The problem is that what we are doing comes too late. As you can see here, there is a very beautiful model to predict, for instance, the spreading of Hyalomma marginatum in Europe. This model was published in 2023, but we know that this vector was present since 2020, 2021. So the model was elaborated too late. So what we have to know is that we should act fast. We should apply this model fast in order to get these vectors and these diseases under control as soon as possible. I don't want to get this story too long, but it is important to say what are the key adaptation strategies for responding to vector-borne disease. You can easily get this information from a very beautiful paper published by Thompson and Stramberry in New England Journal of Medicine, 2022. Strong public policies, vector and disease surveillance programs, vector control programs, early warning and monitoring system, public awareness and engagement campaigns, but also awareness of the risk, signs, and symptoms of vector-borne diseases. And I hope that this presentation could be useful to increase the knowledge of these important diseases, use of personal protective measures, seeking of medical attention for any acute febrile illness, and adherence to treatment plans are very important points. In the paper, the authors elaborated on these categories of intervention by illustrating what are the adaptation measures, but I don't have enough time to go more in depth. I want only to say that very recently, the National Institute of Health in Italy has started a very nice informative campaign in schools, museums, and university in order to increase knowledge about mosquitoes and the relative diseases. And I think that this campaign is very important. We have also to focus on vaccinations. I've reported here the most important papers on the currently available vaccine, but there are also other vaccines currently on development. We have to work on monoclonal antibodies. We know that there is a monoclonal antibody to prevent malaria, which is expensive, but nevertheless very effective. And there are results of a phase 1 study on a monoclonal antibody for dengue virus. So this is another line of research. Another line of research is the repurposing of drugs, searching new drugs, searching new targets. This is very important. It has been proposed that remdesivir can have a broad spectrum of activity for several flaviviruses, but we have to test these in vivo. We have data in vitro on new drugs, RNA-dependent RNA polymerase for West Nile virus. And I hope that, these drugs will be experimented in a very fast way also in animals and human beings, because it is very important to have these drugs available, if effective and well tolerated, as soon as possible. Last but not least, as I told, we need inexpensive, accurate, and widely available diagnostics for climate-sensitive vector-borne diseases, as well as studies with multi-omics approaches to clusterize distinct phenotypes of the diseases, thereby improving treatment strategies for tailored treatment. Because as I showed you, the diseases can be asymptomatic, paucisymptomatic, or very severe. It is more than interesting for patients to understand and to predict which patients are going to progress to more severe diseases and which cases will stay asymptomatic or paucisymptomatic in order to provide a personalized treatment for the sake of the patient. Some good news. On December 3 last year, the COP28, which is the conference of the parties, provided $1 billion US for mitigation and adaptation programs. This is a very good news. But the bad news is that we still need a climate change justice. Unfortunately, the most vulnerable groups are those who suffer most from climate change consequences, including vector-borne diseases. And we have to do more to increase equity for the sake of these most vulnerable groups, such as children, older adults, low wealth communities, communities of color, those who live in resource-limited settings first. And another problem is that, as you can see, vector-borne diseases are an emergent problem. Unfortunately, the interest of researchers for these diseases is not very high. As you can see here, the number of papers and the number of citations for a very important disease such as West Nile was decreasing since 2005. And for me, this is not a good news. We have to increase the awareness and the interest of researchers and scientists for this important disease. We cannot sleep. We have to be very awake and very active to fight these important diseases, which are going to become the priority among infectious diseases in the upcoming years. Thank you very much for your attention.
Thank you very much, Carlo, for this very inspiring and comprehensive presentation. Before opening the floor to the question, I have actually a question myself, if everyone will allow me. You mentioned about the influence of climate change on the spread and propagation of the different vector-borne diseases. Do you think, well, this climate change will lead to different, as you mentioned, pattern of precipitation, temperature, and all the other weather conditions? Do you think vector-borne diseases, maybe let's focus on dengue or West Nile virus, they will be more affected by the change in the seasonality, or mainly about the extremes of, for example, like intense floods or intense droughts rather than seasonality?
I think that we should not oversimplify this problem, because clearly climate change is important, but also human behavior is important. For instance, deforestation, which is clearly related to climate change, but this is not exactly the same thing. So we have to consider this problem from a very broad perspective. And this is my first answer. The second answer is that extremes are very important, but clearly the most extreme weather can also, for instance, temperature, can also be dangerous to the vectors, because there is an interval of temperature. If the weather is very dry or very hot, some insects are not able to live. And that's why, for instance, the vector for malaria, Anopheles, probably is being replaced by Aedes, even in Africa. So I think that extremes are very important, but they can act either way. I think that seasonality can be more important, because some insects, for instance, Aedes, their eggs are able to survive from one season to another. They stay there. And over the next season, when the temperature is ideal, you know, they are still alive